Welcome to Niagara Health's Neonatal Intensive Care Unit, or most commonly referred to as the NICU.
Our NICU is located at our St. Catherine's Hospital at 1200 4th Avenue. My name is Jessie and I'm a registered nurse in the NICU.
My name is Abby and I am also a registered nurse in the NICU. Niagara Health is honored to provide care on the lands where Indigenous people have lived for thousands of years with their own unique cultures, identities, traditions, and languages. These lands are steeped in the rich history of the First Nations such as the Hattaway-Wendurong, the Haudenosaunee, the Anishinaabe, and the Mississaugas of the Credit First Nations. There are many First Nations, Métis, and Inuit peoples from across Turtle Island who live and work in Niagara today. We are committed to listening and learning more about the history and current experiences of Indigenous peoples and acknowledge our responsibility to take meaningful action towards reconciliation in the healthcare system. We are the only NICU in the Niagara region and take care of babies who are 30 weeks and older.
Did you know that 10 to 15% of all newborn babies are cared for in the NICU? There are many reasons why your baby may require NICU care.
Sometimes babies are born with health issues and need support. Sometimes we know about these issues beforehand, and sometimes we find out after.
In the NICU, we provide support and care as your baby grows and develops.
During this video, you will learn what to expect when your baby is in the NICU.
We understand that having a baby in the NICU may feel overwhelming. Your healthcare team will work together with you to take care of your baby.
Remember to take care of yourself. Ask questions and don't be afraid to ask for help. We're here to support you and your baby. The NICU is located on the 4th floor, close to our Women and Babies unit. The NICU is locked. When you arrive, please use the phone outside the NICU doors to let staff know that you have arrived. Parents will be given a swipe card to help them get in and out of the unit. Your baby is not strong enough yet to fight germs. It is very important to stay home if you are feeling unwell. It is important to wash your hands very well as soon as you enter the NICU. You must wash your hands before touching your baby and after using the washroom, blowing your nose, or eating. Most of our rooms are private, with everything your baby will need. Each room also has a single bed where you can stay with your baby 24/7 if you choose. The unit has family washrooms and showers for you to use. We also have a fridge that you may use and a cafeteria on the main floor of the hospital.
It is normal to feel many different emotions when your baby is in the NICU. You are the most important person in your baby's healthcare team, and you are your baby's voice. Each day, your nurse will give you updates about how your baby is doing and help you care for them. This might include changing your baby's diaper, taking their temperature, and giving your baby a bath. Holding your baby skin to skin is a wonderful way to soothe and calm your baby. You can read stories or sing songs to your baby. Some families like to bring in special things such as blankets, clothes, or books. To protect your baby, everything must be properly cleaned before being brought to the NICU. We understand that sometimes you cannot be with your baby. You can call the NICU at any time to ask how your baby is doing. You may also ask if a cuddler can visit your baby. A cuddler is a trained volunteer who will hold and comfort your baby if you so choose.
Your baby may stay in a special bed called an isolette. This will help to keep your baby warm and comfortable. They may also be attached to a monitor. This tool helps your team care for your baby and see how they are doing. Sensors are placed on your baby that measure how fast they are breathing, their heart rate, their blood pressure, and their oxygen levels. You may hear beeping or an alarm from the monitor. The alarm lets your healthcare team know that your baby may need special attention. Some babies may have a tube to give them nutrition until they are ready to eat on their own. Some babies may also have a tube or mask to help them breathe until they can breathe on their own. Your healthcare team will help you feed your baby. Your feeding team may include lactation consultants, occupational therapists, dietitians, and nurses. Some babies may not be ready to have food. If your baby is not ready for food, they will receive nutrition through a special tube called an IV. Your baby may also be fed through a feeding tube called an NG or OG that will take milk or formula to their stomach. A feeding tube may be needed until your baby is ready to be breast or bottle fed.
We have a large healthcare team to help take care of your baby. Your team may include nurses who have special training and experience taking care of babies and their families, respiratory therapists who help care for babies who need breathing support, nurse practitioners with highly specialized training in caring for babies, dietitians who will plan the best nutrition for your baby, social workers whose role is to wrap you and your baby in care and support. lactation consultants to support new parents with breastfeeding and pumping, occupational therapists who will support your baby's growth and development, special doctors called pediatricians and neonatologists who will oversee your baby's care, a pharmacist who will manage your baby's medications, and a child life specialist who is also available to help brothers and sisters who may have questions about their new sibling or the NICU. Niagara Health also has an Indigenous Health Services and Reconciliation team that will identify and act on priorities that ensure inclusive, equitable, and compassionate healthcare journeys for all Indigenous patients and their families.
Your healthcare team will check on your baby often. Your team will round with you each day. Rounding is when the healthcare team comes to your baby's room to talk about how they are doing and update their plan of care. Rounding is a great time for you to ask questions and tell your healthcare team what matters most to you. If you are not here while the team is rounding, your nurse would be happy to share your questions or concerns with the team. Niagara Health, in partnership with Ronald McDonald House Charity South Central Ontario, operates a family room located on the 4th floor outside the Children's Health Unit. The space is open 24/7 and family members are welcome to access the space at any time during their visit to grab a coffee, snack, or to take a moment to rest and recharge away from the clinical setting. The family room features respite areas, laundry, no-cost food services, and in partnership with our Children's Health Unit and NICU, family programming such as movie nights, toy drives, and more. The day-to-day operations of the room are run by Niagara Health volunteers who are available to answer any questions you might have.
We are here to support you and your baby every step of the way. If you have any questions or concerns, please ask your healthcare team.